You are seeing a hemorrhoid. Look, the hemorrhoid is at the tip of my forceps. Here is the hemorrhoid, see? This is a hemorrhoid. This is a grade 4 internal hemorrhoid. It has both vascular and skin components. At the tip of the laser, I'm showing you. Now look here. I'm going to remove this hemorrhoid with the laser. Here, look. See? There is already the internal sphincter muscle of the anus. See? There is the internal sphincter muscle of the anus. And here is the hemorrhoidal vessel. Through this, I will lower the pressure of the anal muscle. In one surgery, I remove the hemorrhoid, remove the fissure, and here with the laser, I lower the pressure of the anal muscle. Understood? Local anesthesia, light sedation, and then discharge. Visit my video channel, the largest in the world in proctology, Proctologista, Dr. Paulo Branco. And now for you, the gay community, you can't complain, right? The gay channel is very cool. Let's give it that support to become the largest gay channel in the world. Proctologista para all gay. Best regards,